if you'll humor me. I'd like to start off my talk today with a little thought experiment. I invite you to imagine what it would be like to be born in a country in which poverty is rampant. You and your 5 siblings grow up in a one-room shack without running water. All of you are expected to pitch in on a small plot of communal land, growing food to sustain yourselves. With all of you working, you're able to put food on the table, but you aren't able to save enough to improve your housing or other circumstances. You only receive some elementary school education, and your life prospects are limited. You grow up, get married, and start your own family, but you have no way to live independently or to improve life for your kids. You notice in your village that some families are starting to improve their lots. They're building larger homes with indoor bathrooms and kitchens. They can afford electronics and nice clothing. Their kids don't have to drop out of school. Some even go on to university. You realize that among these families, there's typically a parent who has gone abroad for work. Although these families spend much of their lives apart, at least they're able to build a better future for those who stay behind. It's an immense sacrifice, and as the breadwinner for your family, you realize it is one you will also be expected to make. So you consider the options of where to migrate. The typical choice is the United States, but this is risky. First, you have to somehow come up with thousands of dollars to pay a human smuggler to help you cross the border with no guarantees of success. Then you have to risk your life crossing a desert or water body with little food or belongings. Many people have died this way, and you fear for your fate. Even if you manage to get in, you will then be considered illegal, and you'll face the constant threat of deportation under a president who has vowed to crack down on bad hombres like you. And you may not see your family again for years. You feel overwhelmed by the prospect. Then you learn of another option. There's a program in Canada that would allow you to work for up to 8 months a year, traveling back and forth on an airplane. You'd be legally employed, so you'd be able to access certain protections like health care. Each year, you'd be able to save a little bit more to feed and educate your kids and to build your home. You apply through your government's Ministry of Labor. You go through an interview and you take part in a medical exam to ensure that you are healthy and able to handle demanding work. You are thrilled to hear when you've been accepted. You attend an orientation session in which you are warned to work hard and obey your employers. You're reminded that there are thousands of other workers in line ready to take your place. Then you wait. You don't know when you will leave or where you will go in Canada. One day you are called and you're told to go to the airport. It's your first time on an airplane, and when you arrive, you're taken to a little-known gem of the world called Brantford, Ontario. It's freezing when you land, and you don't have any warm clothes. You don't know anyone, and you don't speak the language. You have to rely on your employer for pretty much everything, from your access to food, housing, healthcare, and work. It's crucial that you maintain a good relationship with them, because their positive evaluation is what will determine if you can come back the next year. You discover that the work is harder than you expected. You work 10 to 14-hour days, 6 to 7 days a week, often in extreme temperatures with repetitive bending and lifting and constant pressure to work faster. Sometimes you're exposed to chemicals. You notice a rash developing and a pain in your back that's getting worse. You feel overwhelmed with sadness missing your family. You know that you're entitled to health care, but you haven't yet been given a health card, and you don't want to complain or ask for time off because you don't want to stand out or do anything to risk losing your job. When your symptoms don't resolve, you realize you need to do something. So on the one night when you and all of your other coworkers are bussed into town to buy groceries, you wait in a long lineup at a walk-in clinic, only to be seen by a doctor who doesn't speak your language, who doesn't understand your issues, and who rushes you through the appointment. Without your health card, you've asked to pay. You waited so long in line that you don't even have time to get your groceries before the bus departs for the farm. You just decide it's not worth seeking health care, and you resolve to working through your pain and your rash and your sadness, all of which only get worse. So what I just described is one example of the reality of about 50,000 men and women who come from countries like Mexico and Jamaica to grow the food we eat here in Ontario and throughout Canada as temporary foreign agricultural workers. These workers have been coming here year after year for over half a century. Here's one of the first crews around 1966. Yet few Canadians have ever heard of them, and even fewer have ever interacted with them. They work in one of the most demanding and dangerous industries in our country. They normally earn minimum wage, and they pay our taxes and into employment insurance, even though they can never receive the benefits. Employers often say that their operations could not survive without migrant workers. Why can't farms attract enough Canadians to do these jobs? Well, this is one example of a real job ad seeking workers for an Ontario farm. Employers are required to post ads like this before they can apply for temporary foreign workers. It reads, must be able to work in a fast-paced environment, repetitive tasks, handling heavy loads, attention to detail, sitting, standing for extended periods, bending, crouching, kneeling, physically demanding, in hot, dusty outdoors and in cold, confined spaces. $11 an hour with experience. Must work 7 days a week. Does this sound like your kind of a dream job? I think you can imagine why there wasn't a lineup of Canadian workers seeking this position. Yet for many migrant workers, this job may be their best shot at improving lives for their families. Migrant workers have become the invisible backbone of our local agricultural economies and communities, including this one. The red areas on this map indicate those with the highest concentration of migrant workers. As you can see, the majority of them work in southern Ontario, in the areas surrounding where we are right now. These men and women are our unseen neighbors. How many of you ate a fruit or a vegetable today? Good. Well, I hope you did. They're good for you. If you did, you tasted the product of their labor. We are all connected to migrant workers. So for the past 12 years, I've had the privilege of conducting research with migrant workers and their families here in Ontario, as well as in Mexico and Jamaica. I've traced the health issues that they experience and the barriers that they often encounter to accessing health care, workers' compensation, and other protections. Now, many aspects of what I discovered shocked and saddened me, but one of the most frustrating was the workers' inability to access the healthcare system to which they are legally entitled when they needed it. My colleagues and I and various community and labor groups have written about this situation in numerous articles and reports. We've met with politicians and we've testified to parliamentary committees. Despite the risks, many migrant workers have also spoken out. They've started petitions, they've held rallies to protest for better rights. Yet even with this ample evidence of the problems facing migrant workers, little has changed. When our government didn't act, we started to look for community-based solutions. I learned of a group called the Occupational Health Clinics for Ontario Workers, or OCAL. Now, these are clinics that specialize in occupational health, and they're multidisciplinary teams. When OCAL learned of the problems facing migrant workers, they hit the ground running to provide specialized places where workers could receive free care with the assistance of translators, at times in places convenient to them, like at shopping malls or worker support centers, or even soccer matches, which it turns out is very handy if you happen to get a soccer ball to the head. So at first these efforts were very informal, with a doctor, nurse, and translator showing up in communities and seeing if any workers needed help. And it didn't take long before many clients were interested in receiving the services. Now, after learning of the occupational health needs facing workers, OCAL also started hosting information-based prevention workshops, sometimes in partnership with employers who allowed them onto their farms. Now, these were all very exciting developments, but the capacity of these efforts to meet all of the needs of migrant workers was limited. We needed more hands on deck. So, in partnership with some Laurier colleagues and some community groups, we founded the Migrant Worker Health Project, with the aim to educate other healthcare providers about the issues and encourage them to make their services more accessible. We made a website and printed resources, and we gave presentations around the province. Now, sharing the information was helpful, but it didn't solve the problem. Many clinicians indicated they would love to do more, but they didn't have the resources. It's hard to convince people to spend money on a population that has no voting power. We were starting to get used to disappointment, but then we met with Donna Cripps, the CEO of the Hamilton, Niagara, Haldeman Brant Local Health Integration Network. Now, that's a mouthful, so we'll just call it the LHIN. Now, when I told Donna about the challenges facing migrant workers, she seemed genuinely concerned, and so she invited us to give a presentation to her and some staff at the LHIN office. Shortly after, the LHIN announced funding would be provided for specialized clinics for migrant workers. Now, this was great, but just having the funding wasn't enough. We also needed dedicated people to provide the services. So 2 community health centers, or CHCs, Quest in Niagara and Grand River right here in Brantford, rose to the challenge. To make services accessible for workers, they really had to think outside of the typical box of healthcare provision. Hours had to be on evenings and weekends, which isn't when doctors normally love to work. They had to find Spanish-speaking translators. And they had to find locations that were convenient to workers to overcome the transportation barriers. So each center examined the resources and contexts in their own communities and determined the best way to make it work. The Grand River CHC partnered with the Simcoe Superstore to provide evening clinics right inside the grocery store where workers were shopping anyway, so they could pick up their potatoes and their prescriptions all in one spot. Now that's convenience. They also offer clinics in Delhi and here in Brantford out of this lovely converted vehicle. They recruited committed local physicians and those from neighboring communities who drive in and provide the services on the weekends. My husband is one of them, and I didn't give him much choice in the matter, but he says it's one of the most rewarding experiences he's had as a doctor. A dedicated community pharmacist works late to ensure that workers can access their prescriptions right after seeing the doctor. Staff and volunteers work tirelessly to promote the clinics, provide interpretation services, and assist workers with follow-up. In Niagara, Quest operates their clinics out of 2 sites, one out of a rented walk-in clinic and the other in partnership with the church. Quest has also expanded its activities into the community, offering primary health care services, as well as health information workshops on topics like diabetes and healthy eating, at community events and on farms. Medical, nursing, and Spanish students and faculty from McMaster and Brock universities staff these clinics on a volunteer basis, gaining invaluable learning experiences in the process. Collectively, these clinics have now seen thousands of clients, and in surveys, 100% of clients reported satisfaction, and 100% said they had enough time with their provider. I imagine it would be quite hard to replicate those kinds of satisfaction rates anywhere else in our healthcare system. Community volunteer groups in both regions, with support from these clinics, also host annual health resource and information fairs. Hundreds of workers attend these events where they receive information and support, as well as enjoy free food, entertainment, and gain a sense of inclusion. Local residents also regularly host social events for workers. Volunteers discuss the value of these initiatives, not only for the workers, but also for the community members, many of whom have formed long-lasting friendships with workers, some of whom have even been lucky enough to visit workers in their tropical homes during our much less desirable winters. So these communities have gone to great lengths to support the health of migrant workers, recognizing that health depends much more than on the physical condition, but also on a sense of belonging and feeling cared for. It's truly been a transformation in front of my eyes, from virtually no support to the groundswell that it is today. And it's all because of the dedicated efforts of individuals who saw the problem and wanted to do their part to help. But let me be clear, these clinics have not solved all of the problems facing migrant workers. Far from it. Despite decades of working here, Canada still does not welcome them as immigrants. They still face long and painful family separations, sometimes for years or decades in a row. They're still largely socially segregated, and many experience racism. The program leaves workers very vulnerable, and they're dependent largely on the goodwill of their employer. This varies widely. Many do report negative housing and working environments. Even the power of the clinicians to enact change in workers' lives is limited by the fact that many workers are too afraid to seek job modifications to improve their health for fear of losing their jobs. Instead, they want interventions like medicines and stretching exercises that won't raise the eyebrows of their employers. When women become pregnant in the program, they often hide their pregnancies, foregoing prenatal care for fear of losing those jobs. When workers are seriously injured or when they die, their families are normally left with little to no support. As Canadians, we have a lot of thinking to do about the way we treat the most vulnerable in our society, and there is still much work to be done. Yet the clinics have made a major difference to address one aspect of workers' well-being while they're in Canada, which is providing a truly accessible form of healthcare that had otherwise been absent. As one migrant worker told me, "At these clinics, I actually feel for the first time as though Canadian people care about me. And I no longer have to choose between worrying about losing my job and accessing the health care I need." And the clinic, they benefit not only the workers, but also the employers who can depend on healthy workforces, the workers' families who rely on the health of their breadwinner and loved one. They reduce pressure on our hospital emergency departments. And really, they benefit all of us who can enjoy healthy, local food. There are positive ripple effects all over the community. So the key message I want to leave you with today is that society's problems can be solved little by little by the strong and dedicated efforts in our communities. Everyone involved in these clinics are inspiring examples of what can happen when we care about each other and when we work together rather than in silos. They are a testament to the power of collaborative, creative community efforts to solve complex problems. And no one person could have achieved all of this on their own. It only works because so many people offer what they can. The pharmacist who stays late, the doctor who drives in on a weekend, the employer who offers a health workshop on their farm, the health administrator who decided to fund the clinics, the business owner who donated space, and the many community members who offer to translate or give rides to workers. The clinics are a sum of these parts, and without each of them working together, they could not succeed. The clinics also work so well because they are driven by people who genuinely care about the neighbors among us, the unrecognized people whose dedicated work allows our agricultural economies to thrive. Migrant workers make enormous sacrifices to be here, and they contribute essential work in our communities. The least we can do is support them to return home to their families, safe and healthy. As individuals, as communities, and as a country, we still have a long way to go to ensure that the migrant workers who live among us are treated with the dignity and respect they deserve. I invite you to join us in whatever way you can towards that goal. Thank you.